So what we see the most is one heart attack, and a heart attack is a spectrum. It can go from a massive heart attack to just some subtle disease that shows up when you're in distress for some other reason when you're in the hospital. So they check something called that troponin level. So if that troponin level is high, it can indicate maybe you have some disease in the coronary arteries that can be explored later on, or it's on the spectrum, the higher end of the spectrum, where you have a massive heart attack and you need to get something called a heart catheterization, which is they go in, it's not open heart surgery, they take this sort of thick needle, they put it in through your wrist. You'll feel about a bee sting, a little bit of pressure on the wrist, but that's about it. And then they'll shoot a dye and they look at your arteries, which are like tubes. And if there's a blockage in the tube, they open it with a stent, which is a spring that opens up the tube. So that's one thing. Another thing we see commonly in the hospital is something called atrial fibrillation. Now, I don't get any kickbacks, I don't get any money for this, but the Apple Watch is good at detecting atrial fibrillation. It's quite sensitive. And KardioMobile has great sensitivity, greater than 90%. It's greater than 80% specific, but greater than 90% sensitive, which means if you have it, it's going to pick it up. So I would recommend, if you're having racing heart rates, or people in your family have this heart rhythm issue, or if you have things like thyroid disease or sleep apnea, those are associated with atrial fibrillation. So you can get, an Apple Watch and it can tell you, and it's pretty good, like I said, if you're in AFib. Because sometimes your heart can race and it's not atrial fibrillation. It's just your heart races sometimes, and that's okay. Your heart can race if you're in pain. Your heart can race if you're nervous. That happens. That happens all the time. Very, very, very common. And sometimes it can go up to, 120. Some people, it may be a little bit more sensitive. But again, that's not necessarily a problem. Your heart's not going to explode and it's going to stop. If it happens to you, you can do some neck massages. It's called carotid massages. Where you just kind of like bear down, or sometimes you can put your face in ice to try to make it go away. And then, of course, you can call your doctor the next day. So that's that. Hey, Joseph, how are you? So the next thing is heart failure. That's another common issue that we see in the hospital and in the clinic. There are two main types of heart failure. One, your pump is weak, so your hearts are pumped. So one of the types is you have a weak pump. The other type is the pump is really stiff, and so it's just not functioning appropriately. So you can go on with these issues and go on with your day-to-day, but sometimes you can get off kilter and then you back up with fluid. And if you back up with fluid, you can get short of breath. You have issues like you can't lie flat, you have to sleep in a recliner chair, or your legs start getting really swollen. These are signs of pump failure. Now, not always, but it's something to let your physician know about so that they can do some testing. They can do lab testing to try to get a sense of, is this heart failure? They may order an echocardiogram, which is an ultrasound. You know how they do the ultrasound with a baby, but they can do it with your chest, and they look at your heart to see, do you have signs of heart failure? And if you do and you're in the hospital, then we give you medications to make you pee a lot, and that's basically how we help it. If you're very sick, then sometimes you'll need life support medicine, and sometimes folks need to be considered for heart transplant. So I don't know if you all remember Kid and Play, but shockingly, Kid from Kid and Play had heart failure to the point where he needed a heart transplant, which is wild, because you just think of him as like the symbol of youth, and thinking that he's, had a heart transplant. That was shocking. And he doesn't look like he had one. He's still moving. He's still keeping it moving. So that goes to say, if you identify the signs, you see a physician, or if you're really concerned, you go to the emergency room. You can get these things taken care of once you know the diagnosis and you stick with the plan. That doesn't mean that these things are a death sentence, but you just have to be aware of your body and if anything's getting worse. Now, sometimes, anxiety can play a role and you may be thinking something's not right, but it's okay to see your physician. They will examine you and see, do you have signs of heart failure? Are you at risk? And then they can, go from there. But if you're worried, it's okay to speak up. So those are the main things.